Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 30 practice questions. Without the way, let's get started.
The client diagnosed with chronic kidney disease on hemodialysis is prescribed lanthanum carbonate. Which interventions should the nurse discuss with the client? Select all that apply. 1. Chew the tablets completely before swallowing. 2. Monitor the dialysis graft for bleeding. 3. Take an over-the-counter proton pump inhibitor. 4. Check the radial pulse prior to taking the medication. 5. Take the medication with or right after meals. The correct answers are 1. Chew the tablets completely before swallowing, and 5. Take the medication with or right after meals. Lanthanum carbonate, an electrolyte and water balancing agent, should not be swallowed. The medication must be chewed for absorption in the intestines. Lanthanum carbonate should be taken with or right after meals. Lanthanum carbonate may cause graft occlusion, not bleeding. Lanthanum carbonate does not increase gastric acid secretion. Therefore, the client would not need to take a proton pump inhibitor. Lanthanum carbonate may cause hypotension, and the blood pressure must be checked, not the pulse rate. The client diagnosed with chronic kidney disease is prescribed apoetin. Which statement best describes the scientific rationale for administering this medication? 1. This medication stimulates red blood cell production. 2. This medication stimulates white blood cell production. 3. This medication is used to treat thrombocytopenia. 4. This medication increases the production of urine. The correct answer is 1. This medication stimulates red blood cell production. Epoetin, a biologic response modifier, is a glycoprotein produced by the kidney that stimulates red blood cell production in response to hypoxia. It is prescribed to treat the anemia that occurs in clients diagnosed with CKD. Filgrastim is the biological response modifier that stimulates WBCs and is not used in the treatment of CKD. Oprelvekin is the biological response modifier that stimulates megakaryocyte and thrombocyte production, which stimulates platelet production to prevent thrombocytopenia in clients receiving chemotherapy. There is no medication that increases the production of urine. Diuretics increase the excretion of urine, but do not affect the production of urine. The nurse is caring for a nulliparous client who attended Lamaze childbirth education classes. Which of the following techniques should the nurse include in her plan of care? Select all that apply. 1. Hypnotic suggestion. 2. Rhythmic chanting. 3. Muscle relaxation. 4. Pelvic rocking. 5. Abdominal massage. The correct answers are 3. Muscle relaxation. 4. Pelvic rocking, and 5. Abdominal massage. Hypnotic suggestion is usually not included in childbirth education based on the Lamaze method. Rhythmic chanting is usually not included in childbirth education based on the Lamaze method. Muscle relaxation is an integral part of Lamaze childbirth education. Pelvic rocking is taught in Lamaze classes as a way of easing back pain during pregnancy and labor. Abdominal massage, called effleurage, is also an integral part of Lamaze childbirth education. Which intervention should the nurse implement when administering epoetin subcutaneously? Select all that apply. 1. Do not shake the vial prior to preparing the injection. 2. Apply a warm washcloth after administering the medication. 3. Discard any unused portion of the vial after pulling up the correct dose. 4. Keep the medication vials in the refrigerator until preparing to administer. 5. Administer the medication intramuscularly in the deltoid muscle. The correct answers are 1. Do not shake the vial prior to preparing the injection. 3. Discard any unused portion of the vial after pulling up the correct dose. And 4. Keep the medication vials in the refrigerator until preparing to administer. Do not shake the vial because shaking may denature the biological response modifier, epoetin rendering it biologically inactive. The nurse should only use the vial for one dose. The nurse should not re-access the vial and should discard any unused portion because the vial contains no preservatives. The medication should be stored in the refrigerator and should be warmed to room temperature prior to its being administered. The nurse should apply ice to numb the injection site, not a warm washcloth after administration. This injection is administered subcutaneously, not intramuscularly. 1 hour ago, a multipara was examined with the following results: 8 centimeters, 50% effaced, and plus 1 station. She is now pushing with contractions, and the fetal head is seen at the vaginal introitus. The nurse concludes that the client is now 1. 9 centimeters dilated, 70% effaced, and plus 2 station. 2. 9 centimeters dilated, 80% effaced, and plus 3 station. 3. 10 centimeters dilated, 90% effaced, and plus 4 station. 4. 10 centimeters dilated, 100% effaced, and plus 5 station. The correct answer is 4. 10 centimeters dilated, 100% effaced, and plus 5 station. In option 1 and 2, this client is still in stage 1, which is when the cervix is not fully effaced or fully dilated, and the station is high. In option 3, although this client is fully dilated, the cervix is not fully effaced, and the baby has not descended far enough. In option 4, the cervix is fully dilated and fully effaced, and the baby is low enough to be seen through the vaginal introitus. Which statement best describes the scientific rationale for administering aluminum hydroxide to a client diagnosed with chronic kidney disease? 1. This medication neutralizes gastric acid production. 2. It binds to phosphorus to help decrease hyperphosphatemia. 3. The medication is administered to decrease the calcium level. 4. It will help decrease episodes of constipation in the client with CKD. The correct answer is 2. It binds to phosphorus to help decrease hyperphosphatemia. Clients with CKD experience an increase in serum phosphorus levels, and administering aluminum hydroxide, an antacid, binds with phosphorus to be excreted in the feces. Option 1 is the scientific rationale for administering antacids to clients with peptic ulcer disease or gastritis, not clients with CKD. Aluminum hydroxide does not affect the calcium level. Aluminum hydroxide can cause constipation. It is not used to treat constipation. On examination of a full-term primipara, a labor nurse notes, active labor, right occiput anterior, 7 centimeters dilated, and plus 3 station. Which of the following should the nurse report to the healthcare provider? 1. Descent is progressing well. 2. Fetal head is not yet engaged. 3. Vaginal delivery is imminent. 4. External rotation is complete. The correct answer is 1. Descent is progressing well. The presenting part is 3 centimeters below the ischial spines. Descent is progressing well. The fetal head is well past engagement. Engagement is defined as 0 station. The woman, a primipara, is only 7 centimeters dilated. Delivery is likely to be many hours away. External rotation does not occur until after delivery of the fetal head. Which statement best describes the scientific rationale for administering calcitriol to a client diagnosed with end-stage renal disease? 1. This medication increases the availability of vitamin D in the intestines. 2. This medication stimulates excretion of calcium from the parathyroid gland. 3. This medication helps the body excrete calcium through the feces. 4. This medication increases serum calcium levels by promoting calcium absorption. The correct answer is 4. This medication increases serum calcium levels by promoting calcium absorption. Calcitriol, a vitamin D analog, increases serum calcium levels by promoting calcium absorption and thereby helps to manage hypocalcemia, which is a symptom of chronic kidney disease. Calcitriol does not affect the availability of vitamin D. Calcitriol is used to treat hypoparathyroidism, but it does not stimulate excretion of calcium from the parathyroid gland. The client in ESRD has hypocalcemia, not hypercalcemia. The nurse observes the unlicensed assistive personnel performing delegated tasks. Which action by the UAP requires immediate intervention? 1. The UAP measures the output of a client who had a transurethral resection of the prostate. 2. The UAP tells the client taking bethanechol, whose urine is green that something must be wrong for the urine to be such an odd color. 3. The UAP encourages the client to drink a glass of water after the nurse has administered the oral antibiotic. 4. The UAP assists the client diagnosed with a urinary tract infection to the bedside commode every 2 hours. The correct answer is 2. The UAP tells the client taking bethanechol, whose urine is green, that something must be wrong for the urine to be such an odd color. A green-blue color indicates the client is taking bethanechol, a urinary stimulant used for clients with a neurogenic bladder. This is an expected color, and the UAP should not indicate that something is wrong with the client. In option 1, the urinary output should be measured frequently in a client who has had a transurethral resection of the prostate. The client will have bladder irrigation, and the indwelling catheter bag will need to be emptied frequently. The nurse would not intervene to stop this action. In option 3, the client should be encouraged to drink fluids. The nurse would not intervene to stop this action. In option 4, this action encourages bowel and urine continence and is part of falls prevention protocol. The nurse would not intervene to stop this action. When performing Leopold maneuvers, the nurse notes that the fetus is in the left occiput anterior position, which is the best position for the nurse to place a fetoscope to hear the fetal heartbeat. 1. Left upper quadrant. 2. Right upper quadrant. 3. Left lower quadrant. 4. Right lower quadrant. The correct answer is 3. Left lower quadrant. The left upper quadrant would be the appropriate place to place a fetoscope to hear the fetal heartbeat if the baby were in the left sacrum anterior position, not the left occiput anterior position. The right upper quadrant would be appropriate if the baby were in the right sacrum anterior position. The fetoscope should be placed in the left lower quadrant for a fetus positioned in the left occiput anterior position as described in the question. The right lower quadrant would be appropriate if the baby were in the right occiput anterior position. The client diagnosed with end-stage renal disease is taking calcitriol. Which assessment data warrants intervention by the nurse? 1. The client reports nausea. 2. The client has had 2 episodes of diarrhea. 3. The client has an increase in the serum creatinine level. 4. The client has blood in the urine. The correct answer is 4. The client has blood in the urine. Hematuria is an adverse effect of calcitriol, a vitamin D analog, and the nurse should notify the HCP. This would warrant taking the client off the medication. Nausea is a side effect of calcitriol and can also result from ESRD itself. Diarrhea is an expected side effect of the medication. Therefore, it would not warrant intervention from the nurse. The client in ESRD would have an increased serum creatinine level. Therefore, this would not warrant immediate intervention by the nurse. A client enters the labor and delivery suite stating that she thinks she is in labor. Which of the following information about the woman should the nurse note from the woman's prenatal record before proceeding with the physical assessment? Select all that apply. 1. Weight gain. 2. Ethnicity and religion. 3. Age. 4. Type of insurance. 5. Gravidity and parity. The correct answers are 1. Weight gain. 2. Ethnicity and religion. 3. Age. And 5. Gravidity and parity. Before proceeding with a physical assessment, the nurse should check the client's weight gain reported in her prenatal record. The client's ethnicity and religion should be noted before physical assessment. This allows the nurse to proceed in a culturally sensitive manner. The client's age should also be noted before the physical assessment is begun. The type of insurance the woman has is not relevant to the nurse. The client's gravidity and parity, how many times she has been pregnant and how many times she has given birth, should also be noted before a physical assessment is begun. The nurse enters a laboring client's room. The client is complaining of intense back pain with each contraction. The nurse concludes that the fetus is likely in which of the following positions? 1. Mentum anterior. 2. Sacrum posterior. 3. Occiput posterior. 4. Scapula anterior. The correct answer is 3. Occiput posterior. A fetus in the mentum anterior position is unlikely to elicit severe back pain in the mother. A fetus in the sacral posterior position is unlikely to elicit severe back pain in the mother. When a fetus is in the occiput posterior position, mothers frequently complain of severe back pain. A fetus in the scapula anterior position is unlikely to elicit severe back pain in the mother. The client diagnosed with chronic kidney disease is taking aluminum hydroxide liquid. Which information should the nurse discuss with the client? 1. Drink at least 500 milliliter of water after taking the medication. 2. Do not drink any water for 1 hour after taking the medication. 3. Drink 2 to 4 ounces of water after taking the medication. 4. Eat 30 minutes prior to taking the aluminum hydroxide. The correct answer is 3. Drink 2 to 4 ounces of water after taking the medication. Liquid antacids should be taken with 2 to 4 ounces of water to ensure that the medication reaches the stomach. The client should not drink more than 4 ounces of water because water quickens the gastric emptying time. Antacids should be taken on an empty stomach and are effective for 30 to 60 minutes before passing into the duodenum. During a vaginal examination, the nurse palpates fetal buttocks that are facing the left posterior and are 1 centimeter above the ischial spines. Which of the following is consistent with this assessment? 1. LOA -1 station. 2. LSP -1 station. 3. LMP +1 station. 4. LSA +1 station. The correct answer is 2. LSP -1 station. The LOA position refers to a fetus whose occiput is facing toward the mother's left anterior, and a presenting part at -1 station is 1 centimeter above the ischial spines. The LSP position is the correct answer. The fetal buttocks are facing toward the mother's left posterior, and buttocks at -1 station are 1 centimeter above the ischial spines. The LMP position refers to a fetus whose face is facing toward the mother's LP, and a presenting part at +1 is 1 centimeter below the ischial spines. The LSA position refers to a fetus whose buttocks are facing toward the mother's LA, and a presenting part at +1 station is 1 centimeter below the ischial spines. The client diagnosed with chronic kidney disease is receiving oral sodium polystyrene. Which assessment data indicates the medication is effective? 1. The client's serum potassium level is 5.8 milliequivalents per liter. 2. The client's serum sodium level is 135 milliequivalents per liter. 3. The client's serum potassium level is 4.2 milliequivalents per liter. 4. The client's serum sodium level is 147 milliequivalents per liter. The correct answer is 3. The client's serum potassium level is 4.2 milliequivalents per liter. Sodium polystyrene is a medication that is administered to decrease an elevated serum potassium level. A potassium level within the normal range of 3.5 to 5.2 milliequivalents per liter, like in option 3, indicates the medication is effective. The elevated serum potassium in option 1 would indicate the medication is not effective. Sodium polystyrene is not used to alter the serum sodium level. A woman who states that she thinks she is in labor enters the labor suite. Which of the following assessments will provide the nurse with the most valuable information regarding the client's labor status? 1. Leopold maneuvers. 2. Fundal contractility. 3. Fetal heart assessment. 4. Vaginal examination. The correct answer is 4. Vaginal examination. Leopold maneuvers, although performed on a woman in labor, assess for fetal position, not the progress of labor. Fundal contractility will assess for uterine contractions, but this is not the most valuable information. Assessment of the fetal heart is critically important in relation to fetal well-being, but it will not determine the progress of labor. A vaginal examination will provide the nurse with the best information about the status of labor. A nurse is caring for a laboring woman who is in transition. Which of the following signs, symptoms would indicate that the woman is progressing into the second stage of labor? Select all that apply. 1. Bulging perineum. 2. Increased bloody show. 3. Spontaneous rupture of the membranes. 4. Uncontrollable urge to push. 5. Inability to breathe through contractions. The correct answers are 1. Bulging perineum, 2. Increased bloody show, and 4. Uncontrollable urge to push. A bulging perineum indicates progression to the second stage of labor. The bloody show increases as a woman enters the second stage of labor. The amniotic sac can rupture at any time. With a fully dilated cervix and bulging perineum, laboring women usually feel a strong urge to push. The gravita's ability to work with her labor is more dependent on her level of pain and her preparation for labor than on the phases and or stages of labor. The nurse is administering hydrochlorothiazide to a client diagnosed with chronic kidney disease. Which assessment data should cause the nurse to question the administration of this medication? Select all that apply. 1. The client's skin turgor on the upper chest is tented. 2. The urine output was 90 milliliter for the last 8 hours. 3. The client's oral mucosa is moist and pink. 4. The client has 3+ sacral and peripheral edema. 5. The client's blood pressure is 90/60 in the left arm. The correct answers are 1. The client's skin turgor on the upper chest is tented, and 5. The client's blood pressure is 90/60 in the left arm. Tented skin turgor indicates the client is dehydrated, and the nurse should question administering the thiazide diuretic hydrochlorothiazide. Diuretics reduce circulating blood volume, which may cause orthostatic hypotension. Because the client's blood pressure is low, the nurse should question administering this medication. The client with CKD would have a less than normal urine output, so the nurse would not question giving the client a diuretic. A moist and pink mucosa indicates the client is hydrated. Therefore, the nurse would not question administering this medication. In option 4, the medication is being administered to help decrease the sacral edema. Therefore, the nurse would not question administering this diuretic. The labor and delivery nurse is performing Leopold maneuvers. A soft round mass is felt in the fundal region. A flat object is noted on the left, and small objects are noted on the right of the uterus. A hard round mass is noted above the symphysis. Which of the following positions is consistent with these findings? 1. Left occipital anterior. 2. Left sacral posterior. 3. Right mentum anterior. 4. Right sacral posterior. The correct answer is 1. Left occipital anterior. The nurse's findings upon performing Leopold maneuvers indicate that the fetus is in the left occiput anterior position. That is, the fetal back is felt on the mother's left side. The small parts are felt on her right side. The buttocks are felt in the fundal region, and the head is felt above her symphysis. In the left sacral posterior position, the fetus's buttocks are facing toward the mother's left posterior. A hard round mass is felt in the fundal region, and a soft round mass is felt above the symphysis. In the right mentum anterior position, the fetus's face is facing toward the mother's right anterior, and small objects are felt on the right of the mother's abdomen with a flat area felt on the mother's left side. In the right sacral posterior position, the fetus's sacrum is facing the mother's right posterior, and a hard round mass is felt in the fundal region, while a soft round mass is felt above the symphysis. The client diagnosed with chronic kidney disease on hemodialysis is prescribed lanthanum carbonate. Which laboratory data indicates the medication is effective? 1. A decreased serum potassium level. 2. A normal serum sodium level. 3. A decreased serum blood urea nitrogen level. 4. A normal serum phosphorus level. The correct answer is 4. A normal serum phosphorus level. Lanthanum carbonate, an electrolyte and water balancing agent, decreases phosphate absorption in the intestines, and the phosphorus is excreted in the feces. A decreased potassium level indicates the dialysis is effective, but not that the medication is effective. This medication does not affect sodium level. A decreased BUN level indicates the dialysis is effective, but not the medication. A client in labor, G2P1001, was admitted 1 hour ago at 2 centimeters dilated and 50% effaced. She was talkative and excited at that time. During the past 10 minutes, she has become serious, closing her eyes and breathing rapidly with each contraction. Which of the following is an accurate nursing assessment of the situation? 1. The client had poor childbirth education prior to labor. 2. The client is exhibiting an expected behavior for labor. 3. The client is becoming hypoxic and hypercapnic. 4. The client needs her alpha-fetoprotein levels checked. The correct answer is 2. The client is exhibiting an expected behavior for labor. There is no indication that this woman has had poor preparation for childbirth. The woman is showing expected signs of the active phase of labor. There is no indication that this woman is showing signs of hypoxia and/or hypercapnia. The alpha-fetoprotein assessment is a test to screen for Down syndrome and neural tube defects in the fetus. It is done during pregnancy. The nurse is assessing the fetal station during a vaginal examination. Which of the following structures should the nurse palpate? 1. Sacral promontory. 2. Ischial spines. 3. Cervix. 4. Symphysis pubis. The correct answer is 2. Ischial spines. Palpating the sacral promontory assesses the obstetric conjugate, not the fetal station. Station is assessed by palpating the ischial spines. Palpating the cervix assesses dilation and effacement, not fetal station. Palpating the symphysis, pubis assesses the obstetric conjugate, not the fetal station. The nurse in the long-term care facility is caring for a client with an indwelling catheter. Which preparation should the nurse order for the client? 1. Cranberry juice with breakfast daily. 2. Nitrofurantoin, 100 milligrams every 12 hours for 7 days. 3. Vitamin C every night at bedtime. 4. Golden Seal 2 milliliters in water, 2 to 3 times daily. The correct answer is 1. Cranberry juice with breakfast daily. Cranberry juice is acidic and will change the pH of the urine, making it harder for bacteria to survive in the environment. It can be used prophylactically to prevent UTIs. It does not treat an infection. The nurse can arrange with the dietitian to include this in the client's dietary plan. Nitrofurantoin, a sulfa drug, is a prescription medication that is used to treat chronic UTIs, but the nurse could not order this medication. In a long-term care facility, over-the-counter vitamin C would require an HCP order. Golden Seal is an herb used for UTIs, but in a long-term care facility, it would require an HCP order. When during the latent phase of labor, should the nurse assess the fetal heart pattern of a low-risk woman, G1P0000? Select all that apply. 1. After vaginal examinations. 2. Before administration of analgesics. 3. Periodically at the end of a contraction. 4. Every 10 minutes. 5. Before ambulating. The correct answers are 1. After vaginal examinations. 2. Before administration of analgesics. 3. Periodically at the end of a contraction. And 5. Before ambulating. The nurse should assess the fetal heart after all vaginal examinations. The nurse should assess the fetal heart before giving the mother any analgesics. The fetal heart should be assessed periodically at the end of a contraction. The fetal heart pattern should be assessed every hour during the latent phase of a low-risk labor. It is not standard protocol to assess every 10 minutes. The nurse should assess the fetal heart before the woman ambulates. The male client is admitted to the medical floor with a diagnosis of pyelonephritis. Which intervention should the nurse implement first? 1. Initiate IV access with a 20-gauge catheter. 2. Administer the IV antibiotic within 2 hours of admission. 3. Obtain a urine specimen for culture and sensitivity. 4. Notify the dietary department to order the client a regular diet. The correct answer is 3. Obtain a urine specimen for culture and sensitivity. The nurse should obtain a clean voided midstream specimen for culture and sensitivity before initiating the antibiotics. This is the first intervention to implement. The IV is important to initiate therapy, but the nurse should obtain a clean voided midstream urine for culture and sensitivity before initiating the treatment. If the culture is not obtained prior to initiating the antibiotic, the results of the laboratory test will be skewed. A diet order is not a priority over getting the treatment started. UTIs in males are difficult to treat and can be life-threatening. While performing Leopold maneuvers on a woman in labor, The nurse palpates a hard round mass in the fundal area, a flat surface on the left side, small objects on the right side, and a soft round mass just above the symphysis. Which of the following is a reasonable conclusion by the nurse? 1. The fetal position is transverse. 2. The fetal presentation is vertex. 3. The fetal lie is vertical. 4. The fetal attitude is flexed. The correct answer is 3. The fetal lie is vertical. With the palpation findings of a hard round mass in the fundal area and soft round mass above the symphysis, the nurse can conclude that the fetal position is not transverse. The nurse can conclude that the fetal lie is vertical. The attitude is difficult to determine when performing Leopold maneuvers. The client diagnosed with glomerulonephritis is receiving trimethoprim sulfa. Which data indicates the medication is effective? 1. A urine-specific gravity of 1.010. 2. Urinalysis with 35 white blood count high power field. 3. Urine pH of 6.9. 4. A negative urine leukocyte esterase. The correct answer is 4. A negative urine leukocyte esterase. A negative urine leukocyte esterase indicates the antibiotic trimethoprim sulfa is effective in treating the infection. Leukocytes and nitrates are used to determine bacteriuria and other sources of UTIs. Urine-specific gravity can indicate dehydration or water intoxication, but it will not provide information about a UTI. A microscopic value of 35 white blood count high power field indicates a UTI, not that the antibiotic is effective. The normal value is less than 5 WBC-HPF. Normal urine pH is 5.0 to 9.0, but the pH does not evaluate a UTI. A woman has just arrived at the labor and delivery suite. To report the client's status to her primary healthcare practitioner, which of the following assessments should the nurse perform? Select all that apply. 1. Fetal heart rate. 2. Contraction pattern. 3. Urinalysis. 4. Vital signs. 5. Biophysical profile. The correct answers are 1. Fetal heart rate. 2. Contraction pattern. And 4. Vital signs. The nurse should assess the fetal heart before reporting the client's status to the healthcare provider. The nurse should assess the contraction pattern before reporting the client's status. A complete urinalysis would likely be ordered by the primary healthcare practitioner once the client has been officially admitted, but the test would not be performed during the initial assessment process. The nurse should assess the woman's vital signs before reporting her status. A biophysical profile is performed only if ordered by a healthcare practitioner. The nurse is administering medications to clients on a urology floor. Which medication should the nurse question? 1. Ceftriaxone to a client who is pregnant. 2. Cephalexin to a client who is allergic to penicillin. 3. Trimethoprim sulfa to a client post-prostate surgery. 4. Nitrofurantoin to a client diagnosed with urinary stasis. The correct answer is 2. Cephalexin to a client who is allergic to penicillin. A cross-sensitivity exists in some clients between penicillin and cephalosporins, such as cephalexin. The nurse should assess the type of reaction that the client experienced when taking penicillin. If the client indicates any symptom of an anaphylactic reaction, the nurse will hold the medication and discuss the situation with the HCP. Ceftriaxone, a third-generation cephalosporin, is in the pregnancy risk category B. No research has shown harm to the fetus in humans or in animals. The nurse would not question this medication. There is no reason for the nurse to question trimethoprim sulfa, a sulfa antibiotic, for a client who has had prostate surgery. There is no reason for the nurse to question nitrofurantoin, a sulfa antibiotic, for a client who has urinary stasis. Nitrofurantoin is used to prevent or treat chronic UTIs.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.